Well, I see you clicked on the video. Once again, my name is Dr. Trevor Miller, and I'm with Integrated Health of Indiana. And in the short video that you just saw, we were talking about glucose and how it enters the cell and goes into the mitochondria. And through the process called the electron transport chain, glucose is taken into the cell, and then it produces what is called ATP. ATP is our energy. It's what we run on. But as with most things, when you look at blood sugar, the lab says 65 to 99 is normal. And that's a huge range. And so consensus says that that's actually not true. So now if you start to go into look at metabolic doctors, people who deal with metabolic syndrome and whatnot, they say that the optimal ranges is between 75 and 85 fasting. Your blood sugar after you eat should never go above 140, and you want to avoid huge glucose spikes. So if you are using a constant glucose monitor, you don't want to see your blood sugar go baseline way up and then drop way down below that baseline. And the reason why is because at that point in time, whatever food you ate or combinations of foods you ate, they don't work for you, and they're causing a huge insulin response. So it should never be above 140. If your blood sugar stays above 126 fasting, you are now classified as a diabetic. But what about that area between 99 and 125? Well, that's pre-diabetes, and there's a lot that you can start to do there to start to control blood sugar so that you don't do damage to the pancreas, you don't do damage to the cells, you don't destroy red blood cells, that hemoglobin A1C number doesn't get high. So you can measure blood sugar very simply. The doctors do it with a blood draw, so you can do it with a blood draw. You can also do it with a constant glucose monitor. I love those devices. We use them with our patients. We have a program through Levels. So I love constant glucose monitors, and constant glucose monitors are a fabulous device because you can be eating and then you can see how that affects you. Perfect example, my wife takes her amino acids at night. And when she takes her amino acids, they taste horrible. And she actually uses lemonade and puts her stuff in there. And so I've always been kind of sketchy about lemonades and Kool-Aids and stuff like that because it's a form of liquid sugar and I don't do well with it. Well, last night she did her lemonade with her aminos. We know the amino acids don't have any sugars in them. She drank her little cup of lemonade and went to 145. I haven't looked at it today. We have the ability to monitor this on the computer, and so I haven't looked at it today to see how low it went. Did it cause a reflex hypoglycemic event? And you can also use a finger prick. So lots of diabetics stick the finger, tap it onto the reagent strip and read out the measurement. And then doctors, of course, draw blood and then they send it into the lab. So indication falling below 75 consistently, and you're tired, and all kinds of things happen. There are several things to watch out for. The biggest things are excessive insulin. Insulin controls glucose. Glucose actually triggers the insulin response, but then to keep you from having huge amounts of blood sugar in your serum and floating around in the body, it's insulin's job after it's been woken up to get that into the cell so that the mitochondria can then give you energy. And so fasting, you should be between 75 and 85. When you eat, 30 minutes after you eat, it should peak. And then after that 30 minutes peak, it should slowly start to come down and go to baseline. If it goes below and you've had a reactive hypoglycemic event, once again, that's another sign of excess insulin. And we really want to start to control insulin because insulin is a very bad player when it's chronically high. It creates all kinds of diseases and issues inside the body. And there are ways to take care of that. Also, it can be an indication of impaired glucose storage, meaning your liver's not making the glycogen, it's not being stored in the tissues, you don't have access to it. And last but not least, the adrenals are too low. your cortisol has remained too high. And so then what we start to see is a hormone called DHEA and cortisol, they go low. Now you have a whole different set of issues. You're also usually very tired. You always want to go to sleep during the day, and there's a lot of problems with that. But you can start to make changes to your lifestyle. And then we can use things to help your body resensitize itself to insulin. You can also do things like intermittent fasting, time restricted feeding. There are all kinds of things to start to correct this. Diabetes is not a genetic determination. It's not a birthright. It doesn't have to happen. Now, what happens if your blood sugar is too high and it stays too high? Well, once again, everybody's heard of insulin resistance. Basically, the cells are numb to the signaling of insulin. And my analogy, especially for females to this, is it's like when you're doing the dishes and you have a load of laundry over there and you got some stuff on the stove and you're working three things at once and you have the kids coming up to you going, Mom, 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 Mom. You don't hear it, but everybody else around you hears this. You are actually tuned out, and the cell becomes tuned out to insulin. And that's a bad thing, because by the time you get to excessive blood sugar all the time, you have gone down a path, a continuum that goes a long way. So medically, if we look at diabetes as being a journey, high blood sugar is way down here at the end of the journey. Things that start to go wrong first are insulin levels. They start to go crazy first. And that's why that is a much better metric for where you're at than the endpoint of diabetes, or simply waiting until you're there. Because if you wait until you're there, you're gaining weight, you've got fatigue, you've probably got some sort of autoimmune issues going because the immune system's going crazy. It just starts a cascade. Other things about insulin or blood sugar being high, early diabetes, metabolic syndrome. Metabolic syndrome is a bunch of different indicators, like your blood sugar being high, like your waist being, if you're male, over 40 inches, and if you're female, your waist is over 36 inches. There is some variability if you are of different nationalities. The other thing is triglycerides are high, your cholesterol's off. Metabolic syndrome is a whole constellation of other issues that have gone wrong, and now we have more work to do to get out of the hole. Other things, B vitamins, especially B1, thiamine. If thiamine is low, blood sugar can go high. Liver congestion or fatty liver. Once again, we're going back to that ability for the body to be able to process things in and out. And we've talked about this in other videos. But if you're starting to get fatty liver, and we'll talk about AST and ALT soon, but if your liver is impaired, if it has a high burden, it has to kind of choose between, do I want to clean up or do I want to make energy? And the thing that we want to do is we want to make it very easy for the liver to just make energy and have very little to do, but that's your lifestyle. So last but not least, cortisol resistant. If you are under acute stress, so you got a bill and you're like, oh my goodness, this is due in a few weeks. I need to do some overtime so I can pay this bill. If you have that stress going on, cortisol is going to go high and it's going to stay high. It's probably going to start waking you up at 2 or 3 in the morning, because you're going to wake up and you're going to be under that stress and you're going to want to go and do something, because you have to do something about that. So when cortisol goes high and remains high, that's not good. But little bits is normal. You know, when you get a little bit of stress, hey, you want to have that extra motivation to go get things done. So that way it doesn't wear you down. Right now, when I see this, you got to think of each of these metrics as one piece of a much bigger puzzle. And we got to figure out what that picture is for you to reverse it. Thank you for your attention, and we'll see you on the next one.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.